Good afternoon, my dear fangs. Welcome back to the cavern. For those of you who are new to the channel, I'm Kasara, or Cassie. We're going to be doing something a little different since last week's true crime case I covered mentioned conduct disorder and oppositional defiant disorder, or ODD for short. So I decided to give you a breakdown of the two disorders since I'm a huge psychology nerd. If the disorders are left untreated, they can escalate into antisocial personality disorder, but that doesn't mean that they are guaranteed to escalate into antisocial personality disorder. There we go. Doesn't mean they will guarantee to escalate into that, which I actually did cover antisocial personality disorder in another video. The card is above me if you're interested in checking that out. I'm also going to leave links on all of the different disorders covered in the description below. This is going to be a long video, so grab some snacks, maybe a drink, chill, relax, and I hope you love psychology as much as I do, because that's pretty much what this is all about. Before we get into it, though, I am going to give you a slight warning. Do not use this to self-diagnose. Something I learned in psychology from my professors. Because we are all biased, and when we hear or read various symptoms, we tend to jump the gun, as they say, and assume that we have the disorder based on a couple symptoms, or, a few symptoms, without understanding that some of these symptoms, there's actual requirements behind them. So for some disorders, they require an age of onset, a length of time, and a frequency of these symptoms to occur. They can't be like once in a while. They have to be more frequent. Things like that. So it's better to see a professional about your worries, I guess you could say, concerning a disorder. Kind of like when people go to WebMD about a couple symptoms and they freak out about an illness and feel that they have it based on a couple symptoms, and they go to their doctor, and their doctor assures them that they're fine, there's nothing wrong with them, they don't have that. It's the same thing with psychology. You need to go to a professional. It's just when you hear or read something, it's the same thing, because a professional would know more so than what you're reading or seeing or hearing. It's actually the same thing with the pharmaceutical ads that we see on TV. A lot of people actually think that some of the medications that they hear would actually help them with some of their ailments, even though they don't have those ailments, but they think they do. So there's a lot of that type of stuff, unfortunately. So it's better to see a professional. Now, if you hear some of this and you think that maybe you or someone you know, like maybe your child or a child that you are around, fits some of these symptoms and you're concerned, sure, you can bring it up with a professional and have them look into it for you and see if, in fact, it is something that, is the disorder that fits and that should be worked with. So, moving on. So, conduct disorder is a type of behavior disorder, which can be caused by brain damage, trauma, genes, social problems, child abuse, or past school failure. I know that might sound a little weird, so let me break that a little bit down for you. Sometimes there's a lot of pressure on kids with school. I actually had a couple friends in school that had way too much pressure put on them when it came to school. Getting perfect grades, being part of all of these extracurricular activities after school, and doing all of this stuff to the point where I'm surprised they didn't have a breakdown, to be honest, because they were so stressed out trying to manage all of their time, get all of their projects done, be there for their programs that they were involved in. Because one of my friends was in JROTC. Another one was involved in, I forget what she was in. She was involved in all kinds of stuff too. So there was like a lot of, and they had to get straight A's on top of it. So when she had a B, I remember her crying and freaking out in class because she got a B. And I didn't get it because I would have killed for a B. For, not literally, of course. I'm just using them as a phrase. When it came to math, because I sucked at math. I was horrible at it because I'm more of a, I don't learn by somebody telling me, I learn by doing. And unfortunately, our school system is, I just show you how to do something and you figure it out. And I don't learn that way. And they talk at you, and I can't learn that way. So I sucked at math because of that. And I didn't do well in math because of it. Everything just went over my head. So when she was crying because she got a B, I didn't get it. I'm so confused. Because I would have been psyched to get a B. Hell, I would have been psyched to get a C. But just because at least I would have passed. So when students fail from all this pressure, they feel like they let themselves down, but not just themselves, but their families as well. So all of that pressure just, there's a lot of breaking point there. And thus can cause conduct disorder. Some children with conduct disorders seem to have problems in the frontal lobe of the brain as well, which interferes with a child's ability to play, avoid harm, and learn from negative experiences. Conduct disorder is more common among boys than girls, and it's more likely to develop in children or teens who come from homes that are dysfunctional, disorganized, or disadvantaged. But that's not to say that it's only these homes or only boys. It's just these are more common, but there are, of course, outliers to everything. Children with mood or anxiety disorders, PTSD, substance use disorder, ADHD, or learning problems are at a higher risk of developing conduct disorder, but again, isn't guaranteed that they're going to develop conduct disorder. They're just at a higher risk of developing conduct disorder. Symptoms of this vary, but the four main groups of behaviors are aggression, destruction, deceitfulness, and violation of rules or age-appropriate norms. Examples of these include intimidating behaviors, bullying, physical fights, cruelty to animals or people, the use of a weapon, forcing someone to do something they don't want to, which unfortunately typically is sexual in nature. Intentionally destroying property, committing arson, lying, theft, shoplifting, delinquency, running away, skipping school, mischief, pranks, etc. Conduct disorder is diagnosed by a child psychiatrist or qualified mental health expert by talking to the teachers and parents about the child's behavior. They may also observe the child and in some cases may require mental health testing of the child. There are 4 methods for treatment: cognitive behavioral therapy, which is actually used quite a bit for many different behavioral disorders. Cognitive behavioral therapy is where a child will learn how to better solve problems, communicate, and handle stress. They'll also learn how to control their impulses and anger. Family therapy, which aids in improving communication skills and family interactions, along with making changes within the family in terms of maybe coming up with more routines, more structure, setting up boundaries, maybe setting up more interaction between the child and the parent, things like that. Peer group therapy would help the child develop better social and interpersonal skills. Then there's medicine, which is not often used to treat conduct disorder, but a child may need them for other symptoms or disorders like ADHD, for instance. Experts aren't entirely sure how to prevent the disorder from occurring in children, since they aren't sure why some children I can't even talk today. Why some children develop the disorder in the first place. The only suggestion is for parents to learn positive parenting strategies that can help create a closer parent-child relationship that creates a safe and stable home life for the child, which seems like common sense, but it's not always easy when there's a lot of stress for the parent. So sometimes it's helpful for the parent to also have therapy when having a child with conduct disorder, because sometimes the parent needs that too. And it's not wrong to have therapy. Therapy can really be beneficial to have somebody to talk to help you with your everyday stressors and handling those stressors. Let's face it, it's not easy today. There's a lot of stress today for everyone. So it's good to have somebody to vent to and talk to and get some help. Moving on to ODD, or Oppositional Defiant Disorder. It is an escalation of conduct disorder, but that doesn't mean that ODD can't occur with conduct disorder, as you saw with last week's true crime case. ODD is a frequent and ongoing pattern of anger, irritability, arguing, and defiance towards parents and or other authority figures. ODD also includes being spiteful and seeking revenge, which is a behavior called vindictiveness, if you didn't know. Emotional and behavioral symptoms of ODD generally last at least 6 months. They include often and easily losing their temper, frequently touchy, and easily annoyed by others, angry or resentful, arguing with adults or people of authority, actively defying or refusing to follow adults' requests or rules, becoming annoyed or upset by people on purpose, blaming others for their own mistakes or misbehaviors, saying mean and or hurtful or hateful things when upset, trying to hurt the feelings of others and seeking revenge, showing vindictive behavior at least twice in the past 6 months, things of that nature. ODD can be mild, moderate, or severe. Mild symptoms occur in only one setting, such as within the home, school, work, or with peers. Moderate symptoms occur in at least 2 settings, and severe symptoms occur in 3 or more settings. For children, symptoms may first be seen only at home, but with time, problem behaviors also may start to occur in other settings, such as school or social activities, and with friends. ODD often occurs with other behavioral or mental health problems, so it can be difficult to tell which symptoms are from ODD and which ones are linked to other problems. A psychological assessment is often required and usually includes the child's overall health, how often the behaviors occur, how severe they are, the emotions and behaviors in different settings and relationships that have occurred, the family situations and interactions, finding out what strategies have been helpful or not in managing the problematic behaviors so that they can determine what strategies might be helpful going forward, issues experienced by the child and the family due to the problematic behaviors, along with possible mental health, learning, or communication problems. Treatment for oppositional defiant disorder primarily involves family-based interventions. However, other types of talk therapy may be included. Treatment often lasts several months or longer. It's important to treat any other problems as well, since they can cause ODD symptoms to worsen if left untreated, hence why it can last longer than several months. Several months, I should say. Late conduct disorder medicines generally are not used for ODD unless the child has another mental health condition. Some treatments for ODD usually include parental skills training, which is conducted by a mental health professional with experience in treating ODD specifically, that will help parents develop skills that are more consistent, positive, and less frustrating for them and the child. In some cases, the child may join the parent in this training, so everyone in the family develops a consistent approach and shared goals on how to handle the issues. Involving other authority figures like teachers or coaches in the training may also be important, so everyone's on the same page in addressing the problematic behaviors. Parent-child interaction therapy is a method where a therapist coaches the parent while they interact with the child. In one approach to this method, the therapist sits behind a one-way mirror. Using an earbud audio device, the therapist guides the parent through strategies that reinforce the child's positive behaviors. As a result, the parent learns more effective parenting techniques that will improve the quality of the relationship with the child and reduce the problematic behaviors, as long as the methods are consistently used outside of therapy. So if the parent isn't consistent with the strategies within the home, obviously the problematic behaviors are going to continue. And if the parent is not upfront with the therapist about strategies that are not working, because if they don't tell the therapist or professional that something isn't working, the therapist or professional can't come up with better strategies to assist the parent and child. So the problematic behaviors are never going to improve, which is a big problem. So it's important to always be upfront and talk to the therapist about everything. Individual therapy can assist the child in learning how they can manage their anger and express feelings in a healthier way. And again, the child has to be consistent with those methods that the therapist comes up with the child. Family therapy can help improve their communication skills, relationships, and aid the family members in learning how to work together. Cognitive problem-solving therapy can aid the child in identifying and changing thought patterns that lead to behavior problems. This type of therapy allows the parent and child to work together to come up with solutions that work for the both of them. And I actually loved having the child and parent work together in therapy and hearing how they were basically how they communicated with one another and the issues that they were having, because when I had the child alone in therapy, they would tell me that everything was fine at home. They wouldn't tell me anything that was going on. But when the parent would talk to me, I would hear everything that was going on. And that was difficult because I couldn't address that individually. So it was nice when I had everybody together. But at the same time, with one in particular scenario that I had, the parent was actually defeated and didn't know, and actually didn't even want to try anything anymore. They felt that nothing worked, so why keep trying anymore? So we kind of butted heads a little bit on any suggestion that I came up with in helping them in kind of alleviating some of the problematic behaviors that they were having within the home. Which was frustrating for me because I wanted to help and I felt like I was wasting my time, I guess you could say, just because they threw out every idea I had just because they felt defeated. So I felt like they needed therapy of their own individually, and they also needed family therapy, and the child needed therapy. And sometimes that is how it is. A lot of times, everybody needs therapy. You need group therapy, you need individual therapy, the parent needs therapy, and just it's better for everybody. But unfortunately, it's hard to do because you need to set up separate times for all of three of those, and people don't always have time for all of that, so that becomes difficult. And it's also better to have a separate therapist. Sometimes, just because you don't feel like there's bias going on as the client. Because sometimes they do feel like there's a bias, like you're telling them something personal, and during family therapy, you may feel like there's a bias because you see them individually too. So sometimes there's that. So sometimes you want to see somebody on your own separate from that. It all depends. But moving on. Social skills training can assist the child in helping them become more flexible and learning how to interact in a more positive and effective way with peers. Part of parent training is assisting parents in giving clear instructions and following through with appropriate consequences when needed, along with recognizing and praising the child's good behaviors and positive traits to encourage desired behaviors. Some parenting techniques may seem like common sense, but learning to use them consistently in the face of opposition, isn't always easy. It can also be difficult when faced with other stressors at home, like financial stressors, marital stressors, things like that. Sometimes it takes routine, practice, and patience. One of the most important things for most parents is, even during the most difficult and disruptive situations, is showing consistent, unconditional love and acceptance of the child and not to be too hard on themselves, the parent. The process can be tough for even the most patient parents. Something that can be helpful during the treatment process within the home setting is creating routines, which having the child assist with is great. Is something I found. Building time together within the weekly schedule, working together with your partner or others within the household to ensure consistent and appropriate discipline procedures, and conducted along with asking for support from teachers, coaches, or other adults who spend time with the child can also be beneficial. Assigning household chores, giving them responsibility. Modeling the behaviors you want the child to have can help the child improve their social skills by seeing the parent interact well with others. Setting limits by giving clear instructions and using consistent, reasonable consequences, and recognizing the child's positive behaviors and praising them as close to the time the parent sees them, and being specific as possible is also beneficial. Providing rewards for positive behavior may also help, especially for younger children, and they don't always have to be materialistic. It's something I had to tell parents because a lot of parents, they thought that they had to buy their kids stuff when they did something good. Like, when their kid did really well on a test. Oh, I have to buy them something. Or, their kid, cleaned their room. Or uh, did something that the parent asked them to do, like without fighting with them. No. Sometimes taking them to see a movie or going out for ice cream, something very simple, can be just as rewarding, if not more, than giving the child a physical item. It can be something so simple that it doesn't always have to be getting them something. And you shouldn't always reward a child for everything they do, if that makes sense. Uh, just because sometimes a kid will do something just to get something, and they may not even actually do something well. They'll do something kind of half-assed in hopes of getting something. So keep that in mind. So it's kind of best to talk to a therapist or professional too, because they'll also come up with some ideas as well on the best times to reward for the behaviors and what types of rewards you can use. That's always great. Let me know what you think of these two disorders in the comments. I hope this clarified the two, and I am sorry for kind of the info dump. Later tonight, I'll be continuing discussing killer couples, so stay tuned for that. Next week, we are going to continue with that as well. I'm going to finish it up. March, I don't know what we're doing. I'm thinking of continuing with true crime cases, because there's some that I'm actually curious about. A specific type. I should say a specific type. And if you want me to keep going about mental illnesses and psychology topics, let me know. I love psychology. I can even talk about methods that have helped families and children, treatment methods that I've used that have helped open communication with families, that you actually can use. It's not harmful. It's not going to hurt. You don't actually have to be in therapy to use. If you just want to have a way to talk to your kid, or you want to just improve communications like with your child, or you just want to have fun with your kid. I actually have a few games that I came up with for families that were actually a lot of fun with them. They actually enjoyed it, and it got them talking and laughing and having fun, and it was great. I was very happy. I had a lot of positive outcomes from some of my strategies that I came up with. But let me know if you want me to talk about anything psychology or anything. Just let me know. Enjoy the rest of your day. Take care. And if I don't see you tonight, have a great weekend. And I will see you next week. Bye, everyone.